Today's Age Well webinar marks the launch of a new public webinar series for 2023. The focus is on Age Well's 8 challenge areas, which drive our research and innovation in supporting older adults and caregivers. And today we're starting with the challenge area, supportive homes and communities. This webinar will look at creating smart homes and how technology-based solutions can help older adults live independently and improve their quality of life. My name is Dr. Josephine McMurray, and as the Associate Scientific Director at Age Well, I couldn't be happier to facilitate today's discussion on the potential for technology that may change how we live in our homes and that supports aging in place, and also about cutting research that's underway and smart home solutions that are in the pipeline or perhaps are already out in the marketplace. Before we get to that, I'd like to acknowledge that although we are meeting virtually today, we'd like to acknowledge the Indigenous peoples of all the lands our speakers inhabit. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. We encourage you to reflect on the land on which you're located and to consider your relationship to the land and the people who are the traditional keepers of that land. Before we introduce our expert panel, I'd like to share with you a bit of information about Age Well. Age Well is Canada's technology and aging network, and its vision is that it's a vision that they have towards Canada's leadership in technology and aging, something that we call Age Tech, and how it benefits the world. Age Well's mission is to develop a community of researchers, older adults, caregivers, partners, and future leaders that accelerates the development of technology-based solutions to make a meaningful difference in the lives of Canadians. That translates into support for almost 250 researchers at 49 universities and research centres in Canada, 1,200 plus trainees, 60 plus Canadian age tech startups, and over 170 technology services, policies, and practices that are in development or actually in the market. We've also supported the development of 4 national innovation hubs. And most importantly, we have 5,000 plus engaged and incredibly enthusiastic older adults and caregivers, many of whom are joining us today. So thank you all for coming. Your interest, support, and the hard work that you do is what sustains us. In today's webinar, you're going to hear more about technologies that are being researched and developed to support aging at home. But there are many other Age Well supported technologies related to aging in place that you may find interesting, and we encourage you to explore. On the next slide, this is Rosa, a robotic cart from Quantum Robotic Systems that carries household items up and down stairs automatically. There's also Centenaire 2, a smart activity sensor from Ultim View that detects and analyzes human activities, showing health trends and sending alerts when emergencies like falls are detected, and only transmits stick figures for privacy protection. On the next slide, this is MaxFinder, a reminder app from JLD Health Solution and the University of Ottawa for older adults with mild cognitive impairment. And it helps with scheduling and reminding them and their caregivers about medications and daily activities. And finally, on this next slide, this is an example of wandering location detection and diversion systems that are coming out of Briere, Carleton University, and the Age Well SAM3 Innovation Hub. It uses motion, contact, and bed sensors to detect a sleeper's movements if they wander out of bed, and if necessary, activates other technologies to encourage them to return to bed, or it alerts a caregiver. You're going to hear more about wandering detection systems, kitchen sensors, and even smart beds today in this webinar. All right. So now it's time to welcome our 3 panelists. First up is Dr. Rafik Goubran. Rafik, can you tell us a bit about yourself and how your research fits in today's topic of creating innovation solutions to aging in place?
Thank you, Josephine. and good afternoon, everyone. My name is Rafik Goubran. I am a Chancellor's Professor and the Vice President Research and International of Carleton University. I'm also an affiliate investigator with the Laurier Research Institute. This assignment allows me to interact more closely with users, older adults, and with healthcare professionals, including physicians, nurses, occupational therapists, physiotherapists, and more. I've been an AgeWell researcher since the inception of AgeWell, and I've been very proud of my association with AgeWell. So my background is engineering, and my research expertise is on sensors and data analytics. So to put it in plain language, my research deals with extracting useful information from data that's generated by many sensors deployed everywhere. So my AgeWell engagement deals with the design of smart homes that can monitor the health and well-being of the home occupant. So aging in place, as you know, is the preferred option for older adults. It is also a cost-effective approach for delivering high-quality healthcare. Smart homes enable healthy and safe aging in place. It also reduces the burden on caregivers. Our objective is the early detection of functional changes in the home occupant and evidence-based improved assessment of interventions. So my AgeWell research has been co-led by medical doctors such as Dr. Frank Knuffel and Dr. Neil Thomas, and by health researchers such as Dr. Heidi Svestrup. In my view, user engagement and multidisciplinary partnerships are vital to any successful project in this area. And I'll be very happy later on to talk to you more about smart homes and how can smart home help aging in place in a healthy and safe way. Thank you.
Oh, thank you so much, Rafik. We're really interested in hearing about SAM3 and the work that you're doing in Ottawa. So next up is Sarah Agbami. Sarah, thanks so much for coming. Can you tell us a little bit about yourself and perhaps the work that you're doing on smart home solutions?
Absolutely. Pleasure to be here. Hello, everyone. So my name is Sarah. I've been with Best Buy, formerly known as Future Shaw, way back in Y2K years, about 23 years ago. So it's a pleasure to be able to talk about how our world makes sense in the world that you're being introduced to. But personally, my passion is always identifying what gaps are out there in terms of life enrichment and applying ourselves to it. So that's been the belief that Best Buy Health has been built on. We are a part of Best Buy Canada, and we're very much here to learn from all the expertise AgeWell has been generously offering to us over the past 4 years. So we are an active member. Our belief continues to be a technology can add value to anyone's life for any age, any type of need. And today I'm excited to talk about how we think about it and how this collaboration has been really exciting for us in terms of validating the human needs and its application to human life at the end of the day, because that's really what matters to us at this end is, are we adding value and benefit to human beings at the end of the day? So happy to be able to talk, and this is a wonderful panel to be a part of. Thanks, Josephine.
Thanks, Sarah. That's a terrific vision. Okay, so last but certainly not least, John, would you mind telling us a little bit about yourself as well? John Hamblin is our third panelist, and I'm really interested about you and your interest in smart home technology.
Great. Thank you, Josephine. In the spirit of full disclosure, I will say that I'm 66 years of age, so I'm definitely very interested in aging well, personally. I spent 30 plus years in technology, going from a coder to CIO of a large TSX listed company. Several years after I worked there, I worked as a mentor, advisor, and investor in startups. And I guess to go rapidly from there, in 2017, I bought a Google Home Mini at a Black Friday sale for $20. And I brought it home and started using it for all sorts of things, including reporting my schedule of the day when I woke up, and using it for communications, free calls anywhere in Canada or the US. And it dawned on me that this could be hugely beneficial to seniors in general. Now, keep in mind, this was 2017, long before COVID, but I myself and many others were aware seniors were quite isolated even before COVID. And so I approached Google about running a pilot project in Nova Scotia with 30 plus independently living seniors, where Google provided the equipment and some new contact software to them. And we ran, actually, it ended up being about a 9-month pilot. The pilot was hugely successful. The seniors loved it. They used it for entertainment, to talk to their relatives, to contact their family and friends. And, by the end of the pilot, it was quite clear to me that this had the future was in technology in the home. Following that project, I got involved with an AgeWell funded project, which we set up at Northwood in Nova Scotia, in Halifax, where we were providing brand new technology to a variety of people who were severely challenged, mostly mobility issues, to allow them to be more independent and take care of themselves. This project is still ongoing with funding from AgeWell and the Nova Scotia government, and has shown to be, in the words of the users, life-changing for these individuals.
Awesome, John. If I can just, so we're going to hear more about that as we go forward. So, and I'll definitely come back to that, because you've got a lot to share with that. So thank you again, all three of you, for those intros. Before we get rolling, I want to let everyone know that we will be addressing many of your questions as we can after our panel. So as questions or comments occur to you, please go ahead and type them into the chat function on Zoom. We'd also love for you to share with us who you are and where you're joining us from today as we come together on this important topic. If you aren't familiar with the chat function, it's the icon shaped like a little speech bubble. And if you click on that icon, you'll open up the box where you can enter any questions or comments. And we're really looking forward to hearing from you. Your involvement and engagement will really be the success of this webinar today. We're also going to be recording today's session, and it will be available on our AgeWell YouTube channel if you want to watch it again, or share it with someone else who you think might be interested. So with that housekeeping out of the way, I'm going to kick things off with a question for the group overall. So the question is this: what are you talking about when you say smart home? What is it that makes a home smart, and how you can use, how can that support aging in place? So Sarah, I'm going to start with you on this one. Do you want to kick it off?
Absolutely. Thanks, Josephine. In our realm, we call any helpful home ultimately a smart home, starting with it being connected, hopefully, to begin with, and without making it sound so overwhelming. Really, I mean, a home is a place we work so hard for all our lives, with the hope that one day we'll start taking care of us. So any feature we can add to a home where such can be done, where some of the things can be made easier, is a consideration, or is so-called smart home. Now that might come in different flavors, all dependent on obviously the homeowners or the space owners needs. Some come with the safety question. It's like, I want a safer space. So what does that mean when it comes to smart home? Some just want to simply be more connected, grandkids, healthcare, whatever the case may be. And some of them simply just want to have more fun within their space. And what are we without fun, really, at the end of the day? So, there's so much to be said around smart, but ultimately it is here to make life easier. It is here to connect the individual to the outside world. And it is here to make sure their life is ultimately enriched. yeah, that's our take on a smart home from Best Buy's side.
So it sounds like a very sort of socio-technical definition. So it's the connection with the people in the home. Terrific. John, same question for you. When we say smart home, what does that mean to you? And how do you think that can support people who are aging in place in their homes? You're on mute, John. We've got to have at least one apiece. So.
To me, a smart home in regards to seniors is giving them access to devices and the training and ability to use them to make their life easier and to allow them to age well in their homes. My Google Home project and the other projects I've worked on highlight some of the real issues, and one of the biggest ones to me is what I call aging equity. The fact is that 40% of Canadian seniors receive the GIS supplement because their income is less than $20,000 a year. So what they really need, if we're going to give them the right to use these smart devices, is a variety of government assistance in terms of both internet support and also in terms of smart tech support. And the biggest challenge that the people on my pilots have had was their lack of affordable, easy access to technical support. And, you know, Best Buy, for one, has a program to support them, and there are many others. But seniors deserve the right to use this, and we need to do things to make sure that they can.
Thanks, John. That's super important. So your definition of smart home actually comes with a caveat around accessibility and the ability to adopt some sort of technology that is appropriate for your needs, but also for your pocketbook. Rafik, as an engineer, I imagine you have a slightly different perspective on what makes a smart home. So I wonder if you could weigh in.
So I fully agree with what my colleagues have said, but maybe I'll explain it from an engineering perspective. So smart homes are equipped with ambient sensors that can monitor the health and well-being of the home occupant. So ideally, we want to say that if everything is normal, no action is taken, nothing happens at all. If a very serious thing comes in, there could be a call to 911. But if we detect any slight variations, for example, in terms of gait, in terms of activities of daily living, some action can be taken in order to provide some early detection of functional changes and also evidence-based improved assessment of intervention. So to me, what are we monitoring? Well, our goal is to monitor mobility, things like gait, bed exit, exercise, to see with respect to a specific individual, is there any change in gait, any change in bed exit characteristics to determine or to detect any early detection, or do any early detection of functional changes. We could monitor as well cognition, wandering and diversion, activities of daily living, hygiene. It can monitor vital signs, heart rate, breathing, blood pressure. It can also monitor well-being, such as weight changes, sleep quality, and so on. And the goal is to be able to detect any problem before it becomes a serious problem.
So Rafik, this sounds a lot like the research that you're doing at SAM3 at the Innovation Hub. I wonder if you can perhaps describe a couple of technologies that you are having some success with that appear to be sort of potential candidates for supporting people who are aging at home.
Thank you. So maybe I'll explain quickly what the AgeWell SAM3 Hub. So the AgeWell SAM3 is a national innovation hub that deals with sensors and analytics to monitor mobility and memory. So SAM3 is a joint initiative that includes AgeWell, the Briere Research Institute, and Carleton University. And the hub focuses on the creation of sensors-based smart technologies that monitors older people's health and well-being to keep them as healthy, safe, and as independent as possible. So the idea is to bring together researchers from engineering, healthcare, industry players, nonprofit organizations, but most importantly, older Canadians and their caregiver to tell us more about what is needed. So we don't want to come up with a solution to a non-existing problem. We want to understand the problem very well and come up with a solution there. So we've worked on pressure-sensitive mats that are placed under the mattress of a bed that can monitor bed exit during the night. How many times did the person leave the bed to go to the bathroom? Is that increasing over time? Is there any health problem that leads to that? Bed exit characteristics, sleep quality, apnea during sleep. So that's one of the technologies we've used. We've also used technologies to measure gait as to how the person is walking, how fast, how slow, and the characteristics of the movement, because we were told that these are all signs of stable or declining health. So these are some examples of what we've done. But I think the most important part here is the partnership, multidisciplinary partnership at all levels. And it has to be user-driven functions as opposed to issues we think are important. No, we need to talk to older adults and find out exactly their needs as well as the healthcare professionals.
So it sounds like the older adults and caregivers in your community are being engaged to participate in SAM3 and in the research. Is that an important part of what you do there, Rafik?
Absolutely. This is extremely vital to the success in any project in that area. I would add to that as well, not just the older adults, but the caregivers as well. And then when it comes to solutions, any solution has to be done based on feedback from healthcare professionals, all aspects of healthcare professionals, and then engineers are there to come up with a solution that helps. And it's not just the solution, it's the user interface as well, the feedback to the user. And then we need to take care a lot of things, like everything has to be user-centered design. And we have to look at issues like interoperability, privacy, security, and user acceptance is the most important part as well there.
Absolutely. Yeah, it has to be able to interoperate with all of the technologies in the home and with your infrastructure. So Sarah, if I can move on to you, Best Buy Health has collaborated with SAM3 as well as the Centre for Technology Adoption for Aging in the North, or CTAN, another Age Well, and in fact its newest National Innovation Hub. I wonder if you could tell us a little bit about those partnerships and perhaps some of the work that you're doing out west.
Absolutely. Thanks, Josephine. I guess if I can paint an umbrella around our relationship with our partnership with Age Well, we wear multiple hats. One of the early hats we got to learn about is understanding how we can support the innovative side of the network, which is the wonderful innovation that comes out of all the hard work everybody's putting in. How do we think about commercializing those solutions and give them legs and arms in the market? So that was the first wonderful hat we started with. And the second one was understanding what we have actually works in relation to what Dr. Goubran just mentioned, which is the side of efficacy. So, we feel good about what we have, but do researchers feel the same way, and do users feel the same way at the end of the day? So one of our early on works with SAM3 was very much exactly what Dr. Goubran just described, was a wellness monitoring solution. Anything from the quality of data, all the way its positioning within the home, and of course the expected outcome, which was very educational. Definitely for our side, it been our first time working with a research partner. And, as that wonderful package was, received the bow on top, we moved on to, different ways of looking at enabling the home. And our most recent collaboration works on multiple actually prongs. It looks at intervention, what does one need what, and then the type of implementation that could go in the home. And we're doing so with Breeder Research Group, Research Institute today, by introducing the role of occupational therapists into this validation, which is quite quite exciting, in fact. So there are solutions, but who needs it? When do they need it? How do they get implemented? Implementation is a big part of everything we talk about, because without that, the user cannot interact successfully. And the hope is that we can come out and tell a story at the end of this collaboration comes this fall. And our collaboration with CTAN is a bit of a different flavor, in fact, much needed, which is, we do a couple of things here and there, but what does that mean to the remote space in Canada? Where CTAN's well positioned at UNBC to reach those far out communities and is more in touch with the needs of those community members. So bringing digital literacy to that space, or any technology that helps mitigate that massive gap that's between human and care. Is there anything we can do or technology can do in this space? Are the type of partnerships we lead with CTAN out of UNBC. So as I can't thank enough our partners around what they bring into us in terms of what works, what still needs to be designed and rethought about, including the involvement of wonderful older adults such as John in the collaboration.
So obviously UNBC is the University of Northern British Columbia and located in Prince George. So lots of interesting issues with respect to sort of remote communities that come up, I guess, in that work as well. So John, you've worked on the user acceptance piece of smart technology with your 6-month Google Home Mini pilot in Nova Scotia. So what are some of the biggest challenges? Sarah talked about implementation and adoption. And I'm wondering what you see in terms of older adults embracing smart home technology. You talked a little bit about cost before and a little bit about tech support. So can you perhaps elaborate a bit?
Yeah, certainly. As I mentioned before, and my main bent in life is to make this affordable for all seniors. And I do run seminars on low cost and no cost technology, devices that can help them but won't break an arm and a leg. But the fact is, the biggest challenge is, one of them is technical support. When we did our Google pilot, we were fortunate enough, we had 35 users and we had 5 technical people spread around, go to their homes, work with them independently, make sure they were set up and follow up. But the technical support is a huge issue. The issue, which has been alluded to by the other panelists, is really the issue of security and privacy, because seniors and everyone else for that matter using home devices is concerned about hacking, about having their information spread. And we really have to work, whenever we're developing new products or services, have to accentuate the security factors that are built in and train seniors. I do a course for seniors on security on the internet and all different methods that you can use to help. But those are definitely key issues. Once they have them and know what's there, they love it.
Okay, great, John. I've just got a little bit of interference, but I'll take a break there. So I wonder if we could just sort of run into that before we head to our audience. Sarah, what about privacy? I mean, some folks are age tech curious, but privacy concerned. So do you have some words of advice related to the use of smart technology that relies on collecting data to learn, for example?
I mean, I would, first of all, I'll call this an industry ambiguous BHAG of a question when it comes to privacy. But the one thing we're learning, which has given us that, some level of trust, when we enter any spaces, are the type of control that the technology owner is now given in order to turn on or off their, privacy features. And that's I would say that's a huge way of controlling what goes in and out of the home. I mean, keep calling it a home or a wearable device. So doesn't mean it's an easy way to get about turning on and off. And this is what digital literacy lessons that John is referring to is going to be very important. So how even do I get into turning, those features off? But so short answer, rest assured there are ways. I mean, the commercialized products today have a way to, give the person different levels of access to their own data, or open up the outside world, their sons, daughters, caregivers, whatever case may be, access to what's happening with their home. But it is within our control for most parts. I mean, as far as we are aware. And we haven't heard of anything catastrophic so far based on the implementations that have gone in. We heard a lot more greater story than not when it comes to enriching lives in that space.
Sure. Rafik, I wonder if I could get you to weigh on this. Do you have any tips for setting up a home to minimize privacy concerns that folks might have? I see some questions in the chat that.
Yes, so privacy is definitely a major concern when it comes to smart homes, and it's relative as well. So I guess we are used now to having devices that have got microphones on to do speech recognition and so on. So those devices did not exist before and they exist now. But certainly something like cameras is something that's very intrusive that most users would not welcome in a smart home. So we're trying to avoid the use of cameras. But even with cameras, as Sarah's mentioned, the user could have the option of turning it off or on when they need, and not just electronically. I guess some systems have got some cover for the lens. So it's not just the cameras there with the light on, but it's not recording, but there is a physical cover on the lens so that it doesn't act. But also, I'm talking about the cameras. There are new systems right now that can take the video, can analyze the video in the home, but the video never leaves the home. So it analyzes the video inside the home and discovers if there's a problem in terms of gate problem, falls, or anything else. But the video never leaves the home. What leaves the home is the analysis of the video, saying the gate has changed or somebody fell or whatever. So that's one possibility that exists. But certainly privacy and security is a major concern that needs to be addressed. Without it, we're not going to get the desired level of user acceptance.
So it sounds like there's sort of a little bit of the foot on the accelerator and on the brake at the same time as we adopt these new technologies. And it sounds like we need to be informed. So if we're having trouble with that, seeking out help from family, friends, or technical support people to make sure that the technology is at the level of privacy that we need and want. Thank you so much for that. That was really terrific. And I think what I'll do now, because it's such an active chat, I've just been watching it. It's so many fantastic questions. I'm actually going to open this up now. Ali, I wonder if you could read off some of the questions that are coming up in the chat for our guests.
Absolutely. We have, how would the panelists see technology benefiting older adults who are having issues with cognition, mild to moderate dementia, and their caregivers?
Who would like to start? John, I saw your microphone come up. Why don't you start?
Well, that is a tough one to deal with, and it's certainly one where there's needs much more research. I've seen a variety of different smart technology assist those with mild to moderate cognitive issues, including some great work with VR goggles that allow them to call up past events in history and landmarks they like, and a number of games which require them to use what they have and to try to improve it and to evaluate it. But it's definitely one of the major factors in the idea of making it available to everyone is to enhance the value for those with cognitive issues.
Yeah, maybe I'll...
Please do weigh in, Rafik.
So there are some specific technologies that could help with mild cognitive impairment or very early stages of cognitive impairment. So, for example, there are medication reminders. So there are medication pill containers that could actually remind the user of something. So that brings the whole issue of prompts and feedback to the user in terms of reminding them to do specific actions. And there are lots of products that can do that. and also putting them in touch with their caregivers. So if they forget to do something, with their permission, I guess we can inform the caregiver that there is something missing. So there is prompts to the home occupant and then prompts to the caregiver, but also there are activities that we could encourage people to do as part of their daily living, something like computer games that are well designed to stimulate the memory, but also test any improvement, stability, or decline in terms of cognition.
Rafik, I wonder if you could speak specifically to an area of the home that at times can become, problematic for people, which is the kitchen.
Yes.
There's specific sensors or technologies that will help people. I know I am absolutely guilty of having left the kettle on the stove many times. I would definitely purchase something if there was something. So maybe you could speak to some of those technologies that you're testing or developing.
Yes, certainly. So there are several. So let me speak about maybe 2 or 3 of them very quickly here. So one of them is forgetting something on the burner, and then that's the risk of fire. So there are technologies that could be there that could monitor if this is happening and then do some actions, even turning the oven off or reminding the user that there is something on the oven that is there. So there are lots of technologies in terms of temperature sensor, thermal cameras, and so on that can do this function very effectively. And also less serious, but also important, is leaving the fridge open and then having the food spoiled there. So there are fridge door reminders that could detect if the fridge door has been left open, and then it reminds the person of this. There is also water and the risk of flooding if somebody forgets the tap on, and then there is some flooding happening. So some humidity sensors, some water detectors, and so on. So there are some technologies that could help in the case of very early stages of cognitive decline. But the idea is how to, or the challenge is how to put all of those together and how to provide the proper feedback to the individual. Like if they forget the fridge open, well, how to remind them of this? With that a voice prompt, or is that a beep or whatever? So all of those requires user-centered design research and finding the best way of doing this. So just I recall a few years ago, we were doing something where we said the person could get really scared if an unknown voice comes in and said, close the fridge now. It could create some issues. So somebody suggested, how about having the next of kin have that voice saying you're forgetting, or the fridge door is open. But it created another set of problems because now the person thought their next of kin is in the house. So there are a number of issues. What I'm saying there is that definitely a lot of research needs to be done, and it cannot be done in isolation from the community. It has to be tested with people and see what works better in realistic conditions.
And that truly is one of AgeWell's strengths, is that their insistence right at the very beginning with any development of these technologies, that they're including older adults and caregivers in that development, in the direction, and in feedback and evaluation. So I think I can certainly say that as an AgeWell researcher, that's top of mind for all of us, as I know it is with your lab, Rafik. All right, I'm going to ask Ali to perhaps look through and find a question that was unanswered, perhaps from earlier on, that somebody might enjoy having a response to.
Of course, we've actually had quite a few questions and comments that sort of revolve around accessibility, but specifically affordability of technology. So wondering if the panelists could comment maybe on some low tech or more affordable options that are available to older adults with fixed incomes or something like that.
John, I'll throw it over to you, and then we'll head to Sarah, I think, for a response. John, go ahead.
Okay, I will say, because I felt I should prompt this, there's a little write-up here. This is a report that, if you can see it, AgeWell is about to issue shortly, that was done by one of the researchers on my project at Northwood, which was funded by AgeWell. the idea behind it is to provide all the challenges that are out there and alternative and methods to deal with them. It's really well done, and I only received it yesterday, so I just read through it. But I think there are a number of different options for smart technology. Some of them are expensive, really neat, but expensive. But the ones that most people can afford are low-cost ones, and some of the sensors are not particularly expensive if you can get them integrated. We're talking about like a water detector, or as Rafik said, a sensor for the stove. But the key is still that the government has to be understanding that having this technology is a huge benefit in the long run, because people can age well at home, they can be remotely supported in medical issues, and the overall cost to the government is less than if they have to go to care facilities or to hospitals. So it's in the benefit of the government to subsidize these, and particularly in rural areas where there's no way you can go to a specialist, but you can certainly see a specialist remotely if you have the internet and the connection. So that's really what I'm pushing at, and what I believe Age Well is pushing as well in terms of government policy.
Most certainly, yeah. There's a lot of activity on the development of infrastructure, particularly trying to get remote and rural areas connected with high speed. Sarah, I wonder if you could talk a little bit about some frugal technology that people could access easily, that might make a difference in their homes for them.
For sure. I like to touch on that, as well as what John was mentioning in relation to, like, it's called the social prescriptions, a new catchphrase now for technology. The most frugal technology is using the best features of what we have today. So how many times have we bought a digital camera and never took it out of an auto setting? Like, it's always been on auto forever. A lot of times you walk into spaces and homes where people actually older adults do have access to their smartphones and devices. The problem is you just don't know how to use the many features it offers. So most frugal is not to buy new ones, and maximize the use of the one that you have. And for that, I think, John mentioned to our digital literacy program is just how to learn to pick out what you have and use simple language in order to access it, and hopefully use that as much as possible without finding the need to buy a new one. I mean, yes, we're Best Buy, obviously we're in a retail business, but we also in the business of needing less when it comes to wanting more, when it comes to technology. So learn to use the very many features your smart devices currently offer. And a lot of it is sitting in your smartphone today. I'll add a link later today if you want to know how to access that. And the second thing I'll say, frugal technology, like John mentioned, a lot of things, in fact, you're right, John, do not cost a lot. Fall prevention is a small sensor built into a light in the hallway. And I'm not advertising anyone's brand, but those are pretty small investments compared to a major fall in a hallway or in a bathroom space. So I think we collectively just have to get very good at the needs analysis first. What is it that we need? And then from there, everybody should have options. Some people like to have an entry-level option. Some people would like to invest in the Fendi version, and that's okay if people have the money to spend there. But how we can show up responsibly is A, teach them how to use what they have, and then B, to show them what options they have, for however much money they have in their pocket. And hopefully government, to John's point, will step up, just like a number of Scandinavian countries where starter kits are now reimbursable, starting at actually earlier ages of 55 for early adoption purposes.
Thanks so much, Sarah. Rafik.
Yeah, so I'll add one more item there, is that sensors in the homes. We have lots of sensors in the homes right now. Many of us have got security, for example, sensors for security and alarm, sensors for heating, ventilation, and air conditioning. So sometimes the big cost is to have that infrastructure. But if somebody has the infrastructure already, let's say for security, adding to them some additional sensors that can monitor health and well-being could be as well a cost-effective way of implementing this, because you're not implementing a brand new system, but you're adding a few sensors to an existing system.
That's a really important point, Rafik, because as this space becomes more busy, as more companies are seeing the opportunities and the needs in this space, there's going to be a lot of choices coming in. So this idea that there might be standards perhaps, or ways of ensuring that there is, as you mentioned before, interoperability between systems, so you're not tied to just one particular platform, will be important for sure. Okay, I'm aware of the time, and I do want to get to as many questions as you can. Ali, have you had an opportunity to look and see if there's another little cluster of questions that the panel might address?
There's quite a few great questions in here.
Awesome.
There was one from Jackie about there's lots of technologies out there. I'm curious whether there's a website or a searchable online resource where older adults or caregivers can go to find technologies that might help them and that have been evaluated by users, either formally or informally. That is to say, how do we avoid the snake oil salesman?
Okay, I'm going to hand this to Sarah because she and I have had this discussion in the past. Sarah, would you like to chat about this?
For sure, and it's real. I mean, I totally get it. So the one movement, I like to call it, we started in Best Buy, is to start talking about technology in form of needs and hardware last. I mean, this is a fast flowing river. I think Josephine, you were talking about next day you wake up, there's another device out there, or there's a next operating system that needs a bit of an upgrade. So, you know, the amazing team I get to work with in Best Buy Health, they made it their job to pick and curate what they think they can match the human needs with and put it in a life solution bundle is what we call it. To say, you know what, we've tried this with a number of scenarios. To us, this device really works very well with this next device. And together they can tick off the following use cases. If use cases are interesting to you, and this might be a good bundle for you to take home. And it's really up to them if they like to hire somebody like a Geek Squad agent who's going to come in and do the implementation and tutorial for them. But it's curation and implementation are two things will help the person start that ecosystem that Dr. Goubran was referring to earlier. It is also a way to save money, not to buy too many things to do that kind of work with. So I would say that is, I mean, check us out. We started with a few bundles already. I don't want to stand here and claim we know everything that's been produced out there. But one thing we can tell you is, the one nice muscle we have is a muscle with manufacturer. A lot of times we do put them in a position where we ask them the tough questions around what does this device do in relation to these human needs? And if they're ticking off most of the boxes, that's where you can end up seeing them on our website. And our promise is not to create another cereal aisle here where people get overwhelmed with what they want at the end of the day, but it's a starting point.
So your advice to other retailers and manufacturers is to listen to their target users, whether they are older adults or their care partners or whatever. John, I think you've probably got some experience here that you might want to share as well.
Yeah, I will make it brief, but when we originally put in the Google Home Minis, these devices didn't even have an on-off switch. They listened to you all the time. It didn't concern me, but it certainly concerned seniors in general. And, now they've become much more privacy concerned, and you have on-off switches for both the light, camera, if it's a camera, or the voice. But, I think the key in the area of devices and training is really to see what's available out there that supports you. I know one of the persons in the chat entered Tech Enhanced Life as a website that provides good information on what's available for seniors that actually works. And I think when I'm talking to the Googles and Amazons, which I talk to quite regularly, I'm always stressing the fact that you keep developing new products, but you have no seniors involved in the development. And then you bring it out and say, I bet these seniors will like this. there's no reason why they would, since they had no involvement in deciding whether it was good. So it's a combination of looking around for training, not getting scammed by just saying, you know, somebody's printed this lovely ad that says it'll make your life easier, and search for something that you really need and a good value. And I have to, in talking to Sarah, I'm one of the people that buys everything to try out. I have all kinds of devices for seniors sitting in my little cupboard there that have never been out of the box. So try to pick things that really will work and that you know will.
And I think we can say that many seniors are very discerning. They want to fill a gap, and they don't necessarily want the technology. They want to take care of the need that they have. So keeping the technology as useful and relevant as possible is really important. And we know, in fact, that, you know, particularly with COVID, that many older adults are seeing technology as a solution because they've tried it. So it's you know, there is a wide open opportunity there for companies and developers to step in, for sure. I wonder if we could just throw open a question to, say, Rafik, to start with. I mean, what do you think are some of the trends out there for the future? So where are we going with this support for aging in your community? Do you think there are some things that we haven't talked about today that are going to be up and coming?
Yes, I think there are lots of, like, the technology evolution is going so fast these days. Like, think of prior to the smartphone to what we had and what we have now in terms of communications. Those of us who are you know, young enough to remember, you know, the modems we had at home and the speed for those modems, and right now the speed of the internet going in, the abilities of the smartphones, like sometimes, you know, a huge multi-million-dollar whole building computer is now fitting inside our phone, the displays, and the new sensing technologies. One sensing technology I haven't talked about is the smell sensor or electronic nose that can help as well for the oven problem, forgetting the oven, can help with hygiene issue, can help with cooking, can help with lots of things. So there are so many technologies that are available right now, but the key is how to combine all of those together and how to be faithful to the user as well in terms of how to assess those technologies from an interoperability perspective and from the truthness of what they deliver. Because sometimes when you see an ad for a technology, you think it does a lot more than it actually does. So there is definitely a need to assess those technologies. So I think AgeWell has an important role to play there as an independent, unbiased entity that could actually assess those technologies in the various living labs that we have, assess them with real users and with real multidisciplinary stakeholders to assess whether they deliver what we need or not. So, but certainly there are so many technologies that are coming up right now, and the key is to see what could be useful to help with smart homes and with monitoring health and well-being.
Terrific. And that's where our innovation hubs and our community labs are going to be doing those very things, looking at evaluating and helping looking at the feasibility of these technologies. So I think we are getting very close to our last question, and perhaps I'll throw this open to Ali now. Ali, if you could pick off one last question for the panel before we wrap this up for today.
We actually had one question about how open older adults are regarding using technology. Are we there yet? You know, what does it look like to you?
And perhaps even further than that, how might you deal with older adults or parents, grandparents who are reluctant, perhaps, with respect to technology? So perhaps, Sarah, we'll start with you and then go to John and Rafik.
For sure. And yes, it's real what you're describing. So, and we had to learn that over the past couple of years. and kind of bring you back to our thinking cave and see how do we go back out there again and talking about solutions. And what we've learned is we need to come out with a way to create genres for what we what we call technology. And sometimes it doesn't have to be smart, it can be dumb. There's nothing wrong with different points of entry. So in fact, we're going to introduce bundles that's going to introduce no tech or very low tech offerings to the individuals that would just help them, let's say, post a knee replacement surgery. And then for them to get in, touch and feel what those low entry level technology could feel like, for them to say, you know what, I'm interested, what else is out there. It's a whole art about creating, for them to seek more as opposed to us, us pushing more solutions their way. So I think there's a way to introduce, and piecemeal is always a nice, graceful way to go about it. And then all the way to creating an ecosystem which is larger. So, and some people just say, I've had enough. This is enough for me, for my lifestyle. I'm good. And a lot of times, like, yeah, you do you. You let us know if more needs kind of come your way. We're happy to answer any questions. It's about that mutual respect, back to the market and understanding where we need to kind of stop asking those questions. And, for as long as that trust is created for more questions to be asked. So nothing wrong with having different entry points and tech levels.
Interesting. And so, John, I mean, you are a role model, and I imagine role modeling can be a pretty important piece of developing trust and helping to motivate people. I wonder if you could speak to the same question.
Yeah, I think in the background, and I've, helped many seniors, done seminars and gone to their houses and others. And I think the key is to sort of get them interested. And, what I'm saying, like, back in the first project we did, and even today, if you give someone a Google Home Mini that's like $39 and you show them how they can do some really basic things with it, get information, make phone calls, find out the temperature, listen to their favorite radio station, you can get them, I guess, hooked on technology. And then, if you want to bring in sensors and new advice and new devices and online training, they're much more likely to say yes. So it's really start small and grow is what I would suggest.
That's a great piece of advice. Rafik, any last piece of advice here from the panel on adoption and from your experience?
I think it's vital to look at user engagement every step of the way. User engagement at the conception of what problem needs to be solved, user engagement during the development process of that solution, and user engagement for the acceptance of the solution from all aspects. So I think the key to success is user engagement and partnerships at all levels. So partnerships, we've talked about partnerships at the level of the users, multidisciplinary in terms of medicine, engineering, industrial design, social sciences, industry, partnership in implementation, multi-sectoral, so government, health solution, private sector, academia, and to come up with feasible business and service solutions. So partnership, I guess, is the end, and user engagement is the key to success.
Oh my gosh, you just segued into our exit here. I think that was a really wonderful summary of much of what we've discussed here today. Dr. Goubran, Sarah, John, I'd like to thank you all for your insights and your advice today. This has been certainly educational for me, and we have had the most active chat that I think I have ever seen on a webinar. So I certainly hope that we can make that available as well. I have no doubt that this has been both a pleasure and educational and developmental for all of our audience as well. Sadly, that's all we have for today. If you'd like to watch this webinar again or share it with a friend, you'll be able to find it on the HWell YouTube channel in about a week. So thank you to our panel. Thank you to our participants. It was really wonderful, and goodbye.